Hi, I'm Dr. Nick Neneman with Neneman Chiropractic Clinic, and thanks for joining us again in another week in our video blog series. A common anatomical term that is thrown around a lot that people talk about when referencing the shoulder is the rotator cuff. People commonly say it wrong, which is okay. You know, they don't know any better, but a lot of times it's called the rotor cuff or the rotator cuff. And again, the correct terminology for it is rotator cuff, C-U-F-F. And I just want to talk about it more today. A lot of people have a misunderstanding on what it is. People think of it as just one muscle in the shoulder, when in fact it's actually 4 muscles that support the shoulder. That's what makes up the cuff. And so that's what I'm going to go over today. I just want you, the viewer, to have a better understanding of the 4 muscles that actually make up the rotator cuff and what their function is in supporting the shoulder. Alright, you can see we have the skeleton here. Just to orient you, you can see here's the spine right here, the rib cage. This is on the back side. Here's the shoulder blade, or otherwise known as the scapula. And then here's the humerus, the humeral head. This is the shoulder socket. The person's looking this way. So just first muscle to cover here. The first muscle I'm going to talk about that's part of the rotator cuff is the supraspinatus. And basically the supraspinatus, it starts from right here on the scapula. And this little ridge right here, this is called the spine of the scapula. It's just kind of an anatomical reference point here. But the supraspinatus runs, it's a muscle that runs from here, runs along the top part of the scapula here. It actually runs under, this is called the acromion right here. It runs underneath right here, and it comes through and attaches to the humeral head here. And so the main purpose of the supraspinatus is it's called abduction. It's in raising the arm laterally. So when you raise that arm sideways out to your side like this, that's called abduction. That's what the supraspinatus helps in. The next muscle I want to talk about that's part of the rotator cuff is called the infraspinatus. And that sits just below the spine of the scapula. So again, this is kind of like a dividing point. Here's the supraspinatus. Here's the infraspinatus. Origin is along the scapula here. Runs up underneath the spine of the scapula. Comes over and again attaches to the humeral head there. The purpose of the infraspinatus is for external rotation of the arm. So it's when you rotate your arm backwards, that muscle helps in doing that. The third rotator cuff muscle I want to talk about is called the teres minor, and that sits just below the infraspinatus. It starts right about in here in the scapula, it runs up and attaches again to the humeral head. And that, just like the infraspinatus, helps you externally rotate your arm, or rotate your arm backwards. So that's its main function. The last of the rotator cuff muscles that I'm going to talk about is called the subscapularis muscle. And just to orient you here, now we're looking at the front side of the skeleton. You can see the head and face there. There's the rib cage, and now we're going to look at the front of the shoulder here. So right in here, this is the front side of the scapula, which again sits on the back side of the rib cage. But the subscapularis is on this inner portion of the shoulder blade, and it runs all the way across, and it comes over and attaches to the front part of the humeral head. This provides stability for the front part of the shoulder joint, and the function of the subscapularis is for internal rotation of the arm. So there you have it. We just went over the 4 muscles of the rotator cuff. As you can see, that shoulder joint is supported in all areas of the joint: the top, the back, the front. And those rotator cuff muscles, help you abduct, externally rotate, internally rotate. So the rotator cuff is really important for the shoulder joint. So that's why when a patient comes in with a shoulder injury, I'm going to assess those 4 muscles to see which one could be affected. And there's a possibility with a shoulder injury it might not be the rotator cuff. It could be labrum, biceps tendon. There's other things it could be. But rotator cuff injuries are very common. So if you're having shoulder pain, come in and see me. You can get checked out, and we can see what's going on. If we're worried about significant tear, you can always get an MRI to verify that. But a lot of times, just with checking, you'll find that it says tendonitis, just a little bit of irritation going on, which is something that I can treat as a chiropractor. So thanks for tuning in again for another week in our video blog series.